welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Iris Schrijver. She is a lifestyle medicine physician. Her Kevin MD article is titled Healthy Patients and Healthy Physicians. Is it possible? Iris, welcome to the show.
Thank you so much for having me, Kevin.
We'll get into your article in a little bit, but first off, just briefly share your story and journey to where you are today.
I'd be happy to. So I was born and raised in the Netherlands, where I also went to medical school. And then I did a postdoctoral fellowship in genetics at Stanford and ultimately became a clinical molecular geneticist. And then I wanted to learn more about laboratory medicine as a whole and completed a residency in clinical pathology. I was then hired on the faculty of the pathology department, also at Stanford, and there I wore many different hats. I was a director of the Molecular Genetic Pathology Lab, which is a diagnostic laboratory where in the beginning of my career, we were primarily focused on the diagnosis of inherited genetic diseases. And as the years went on, of course, with the advent of high throughput methods and with genomics, we were able to diagnose cancers, but also provide prognosis, therapy predictions, and molecular minimal residual disease testing. So it was a great sandbox to play in. And I also directed the clinical pathology residency program and helped develop one of the first molecular genetic pathology fellowship programs. And I had a research lab. So as you know, academic medicine can be very rewarding, but it can also be kind of all-consuming and demanding. So a few years ago, my husband and I simultaneously decided to step away from employment and embark on new adventures. But I still remain very happily affiliated with Stanford as an adjunct clinical professor. And that allows me to be involved in teaching and mentoring. And both of those things I tremendously enjoy. But we moved from California to Oregon and pursued a very different lifestyle with more attention to personal quality of life. And it allowed me to engage with Clackamas Volunteers in Medicine, which is a free clinic in our large county for uninsured individuals. And it also gave me time to write my book. And the seed of that actually had started during a sabbatical at Stanford, but of course I never had the time to complete it. And that book is On the Path to Health, Well-Being, and Fulfillment. And it was recently published. And through the writing of the book, I also discovered lifestyle medicine and became a certified lifestyle medicine physician. So it's quite a change. You know, it may seem ironic that a pathologist, where the emphasis is so much on disease, writes a book about health and well-being. But I think that we're beginning to see a shift in medicine away from only disease management to also more of a focus on how we can sustain health, how we can improve health and increase well-being. And, you know, we have a chronic disease epidemic in this country, right? So it's very much needed that we are redirecting our attention. And as a geneticist, it was kind of interesting to discover that maybe 30 to 40% of our happiness is determined by genes and only a quarter of our longevity. So I think at the moment, lifestyle medicine really is a great tool for all of us.
So, as a lifestyle medicine physician, walk me through a typical day and some of the typical cases that you would see.
Oh, a lifestyle medicine physician would basically help individuals and their families adopt and sustain healthy lifestyles so that they can improve their quality of life. It is a medical specialty that uses evidence-based lifestyle therapeutic approaches, and it uses that primarily to prevent, treat, and infuse intensively enough also reverse chronic diseases like heart disease, like diabetes, and so on. So that's basically what a lifestyle medicine physician does. It's usually practiced in a team with nutritionists, you know, with nurses, physical therapy as needed. And it's really looking at the whole person, right? And I think that's different. And that also creates a ripple effect because we're looking at health restoration and a return to vitality. And you can do that in the context of patient care, their families, and ultimately the community. But as somebody who practices this, you also directly see how it affects healthcare providers themselves. And lifestyle medicine has 6 pillars. Maybe I can talk about that.
Yeah, you talk more about that in your article, right? So, healthy
Yes.
patients and healthy physicians. Is it possible? So, yes, talk more about your article for those who didn't get a chance to read it.
Absolutely. So, this article came out of the work in my book because in the book, I take a good look at the mind, the body, and the world by which they are influenced. Basically, I take a look at the scientific basis of what we think we know about healthy living. And I also wrote it to highlight the issues with the status quo in health and healthcare and to provide a path forward. So, in that sense, it's very relevant to us as healthcare providers. Because, as I write in my article, if we want to achieve this very ambitious quintuple aim of better health outcomes, a better patient experience in healthcare, and lower cost, all of that in an environment of health equity and clinician well being, then we need a whole new health ecosystem. We really need to have a change, and the incentives at the moment are very misaligned,
Hmm.
right? So in lifestyle medicine, there is that change in practice. So the 6 pillars of lifestyle medicine, as I describe in my article, are first a nutrient dense, whole foods, plant strong way of eating. We all know that we need to increase our fruit and vegetable intake, and it's the same for physicians because we have many obese physicians or physicians who don't exercise. I mean, at the moment, more than 72% of people in America are either overweight or obese, and it includes physicians. If you are a physician who is obese, you're much less likely to counsel on weight loss and nutrition.
Hmm.
And the same goes for exercise. So this is very important. And we, of course, all know that more fruits and vegetables protect us against chronic diseases and some cancers as well, and improve our mood. The second pillar is optimizing and individualizing physical activity plans. There too, we know it's a powerful lifter of mood. It creates positive emotions, supports our health, and supports longevity. The third pillar is to improve restorative sleep. I always say every good day starts with a good night's sleep.
Hmm.
And if you don't sleep well, you're likely to eat 300 more calories the next day. And in the long term, you're at risk for weight gain as well as several cancers, actually. So it's very important. And of course, it also reduces anxiety and stress and reduces the risk for depression. The fourth pillar is to stop smoking, tobacco use, and also reduce exposure to harmful substances. And there I'll be very brief because we all know about that one, except that we often frame it in the way that we have the freedom to do something. And it can be so much more liberating to have freedom. And then the fifth pillar is making and maintaining good, positive connections, good social relationships. You probably know about the GRANT study, which is the longest study of health and well-being and longevity. It went on for more than 75 years now, and it clearly showed that at the heart of a happy, healthy, long life are social connections.
Hmm.
So that's something we need to pay attention to as well. And then finally, especially for physicians, managing stress with healthy coping strategies. And there, I really like the concept of positive health, where we take the 6 pillars of lifestyle medicine and combine them with positive psychology, because stress management can boost our resilience, but it doesn't quite get us to this point of flourishing and thriving. And that's what I wanted to highlight in my article, that sometimes we feel like we're in a storm where our boats are overturned. But with lifestyle medicine, we can all lift our boats with the rising tide.
Now, take us into your exam room when you talk to individuals about these pillars of lifestyle medicine. What are some of the obstacles and challenges that you face in having these individuals adopt some of these pillars, and how do you overcome those challenges?
Well, I'm currently building a lifestyle medicine program for the clinic for Clackamas volunteers in medicine. So I can only comment on that in a general way. There are many barriers. There are many barriers in our minds. There are also very practical barriers for the patient population that we deal with in this clinic. For some of these patients, it's the matter of choosing between food on the table and medical care. So that's why they come to our clinic. And I think we need to really realize that this ecology of disease that we have right now in the healthcare system, but also in society at large, affects individuals as well and how they can take care of themselves. So, with lifestyle medicine, we use techniques like motivational interviewing, but also very practical approaches like SMART goals and frequent follow up. The appointments are typically longer and more comprehensive. There's a lot of support to make these changes and roll them out step by step at the pace with which the patient is comfortable. It needs to be a dance, not a top down approach, but rather figuring out what is important to the patient and then making those improvements step by step.
And for the clinicians listening to this podcast, and they may take a look at your 6 pillars and want to make some changes in their own life. Clinicians, as you know, under tremendous amount of stress and pressure and don't have a lot of time. What are some immediate next steps that these clinicians should take if they want to integrate more of a lifestyle medicine approach into their lifestyle?
Yes. So I would encourage them to read my book,
Mhm.
of course. And then I would also encourage them to do a few things immediately. First of all, I would like them to evaluate their own health, which part of their own health and well being can use a boost. And that requires some introspection, that requires some time, but we usually all know where it's at and what we would really like to change. And I think that on the path to health, well being, and fulfillment, we need to assess where we've come from, where we find ourselves at present, and then envision a compelling future. In medicine, especially, we see so many physicians right now who are running from or moving from a bad situation. What I would like to see more, because we have so many opportunities in medicine, I would like to see more of physicians moving to that compelling vision of a future that they can create for themselves. And I'd like them to be curious, curious about the power of the science we have today to really restore their patients' health, but also their own health. So that is, be curious, be critical also. There's so much information, and that's great. It's true for patients and physicians that we have a lot of information at our fingertips,
Mhm.
and that can be exciting and helpful. But there's also a lot to wade through. And it can be confusing because so many of our sources of information contradict each other. So be discerning about that. Nourish your health and well being with what we know is based on validity. And then I'd like everybody to become an advocate for health, well being, and fulfillment because it protects us against chronic diseases. It helps our patients. And even with COVID, we've seen that, any new health challenge that we face and our patients face will be improved by these pretty straightforward approaches.
We're talking to Iris Schrijver. She's a lifestyle medicine physician. We're talking about her Kevin MD article, Healthy Patients and Healthy Physicians. Is it possible? Iris, how does one go about finding a certified lifestyle medicine physician?
I think a quick internet search will do the trick. Also, the American College of Lifestyle Medicine has resources for physicians, for patients, and also that's a place where you can find practicing lifestyle medicine physicians. And of course, you can reach me at lifestyleforhealthandwellness.com or just through my email, irismd@stanford.edu.
And my final question, what are some of your take home messages that you want to leave with the Kevin MD audience?
Well, the take home messages really are that doctors, managers, and institutional leaders need to focus more on what optimizes health and well-being in the workplace. We now see an increased emphasis on self-care because everybody realizes the tremendous personal, institutional, and societal cost of burnout and disability. We need to be well in order to do well. So that requires a reorientation of our mindset and of our healthcare system. And only that way will we ultimately, hopefully, arrive at affordable, accessible, and sustainable healthcare.
Iris, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you so much, Kevin.